Welcome to the Asher Acupuncture Podcast, sharing clinical tips and techniques to help you help more patients. Here's your host, Eric Shanky.
I'm really happy today to be talking with Sharon Sauer. Sharon Sauer is an expert on using trigger point therapy for pain conditions. She's also the founder of the Pain Free and Full Function Clinic in Chicago. She's an author of the Trigger Point Therapy for Low Back Pain workbook here. Sharon, so happy to have you on. Thanks for being on my show. I want to do a couple shameless plugs. One is for the book, Trigger Point Therapy for Low Back Pain. I consider it a must-have for any clinician's library. Also, too, Sharon, I'm on a lot of email lists, but I always look forward to the emails from the Myopain Institute. They're just jam-packed with good information. I've actually made a little subfolder in my email where I keep all your emails there.
That's wonderful.
And even if people that are familiar with trigger points and muscles and things like that, it's a great reminder. You get that email and read it over and like, oh, that's right. That's what the scalings do. That's where they refer. And you've got all those exercises in it. You've got diagnosis, exercises, self-therapy at home. It's just really fantastic.
I'm glad you like it.
And the other thing,
I was thinking of writing another book, but then I started the newsletter, and I've been doing that every month. So it's almost like all those newsletters together. It's sort of a book in itself.
I think you're right. Yeah, you've done most of the hard work. The other thing too is you've got that upcoming master course, the Body Workers Master Course,
which
it's starting today, and we're recording this February 2nd. It's starting today, and it's absolutely free. And I was on your website, Myopain, and I'll put links below for the viewers to check out on their own.
Yes.
And just the free handouts that you're giving, those charts and the handouts, it's unbelievable. I want to thank you for making such a contribution to the field. I just think you should be really proud of yourself and the work you've done, all the hard work you've put in for decades and decades, and you've really helped to advance the field. And I'm just really happy to have you on today. And Sharon, so my website is really geared towards acupuncturists, and in acupuncture, there's a category of acupuncture points that are called Asher points, and that means, that's it. And so it's a tender point. It's a tender point that is used for therapy, and it really corresponds well to trigger point. Could you explain to my audience that may not be familiar with trigger points what a trigger point is?
Well, a trigger point is a dysfunction between the nerve and the muscle. So it's a neuromuscular dysfunction. And what it is the nerve comes to the muscle to tell it to do its job, contract. And the muscle is filled with those painful chemicals that we found in it. And it goes, well, I can't do anything. I'm filled with painful chemicals, and I don't have any ATP, nothing to eat, and I can't contract. And so instead of contracting, it expresses the referred pain pattern. And if you know the referred pain pattern, then you know which muscle to treat, or if you know the dysfunction. So if you know the dysfunction, so I have over here on this wall, over here, all the range of motion tests, and if you can't pass those tests, then you know that these muscles would be, so that's the range of motion algorithm. And we have, of course, what Travell and Simon created for us, which is the referred pain algorithm. So if you have that pain pattern, then this muscle is 80% of the time not in the place where the pain is experienced. So 80% of the time is someplace else.
And as an example, I think on one of the emails you sent, it might have been about the triceps and how people can't fully extend.
Right, so that would be the test. So if you can't get your hand, so if your arm is here, then you know, whoa, yeah, you probably have trigger points in your triceps muscle. So that's one of the tests. So every one of the tests, so I have like 60 some tests. And all those tests, if you can't pass, so you should be able to pass all those. If you can pass all those range of motion tests, then you're going to be able to probably be pain-free and your joints fully move.
And so this segues into the topic I wanted to get into is what is the most common shoulder problem you treat, and how do you diagnose it, and then how do you treat it? And so it sounds like you would listen to the patient and find out where they're describing their pain referral.
Well, this is what I put this on the website. So if you look here, I put cordon off the body into 60 areas. Mm-hmm. And so if you went to the front of the shoulder, so a lot of times people have pain in the front of the shoulder, right? Mm-hmm. So one very common pain is front of the shoulder pain. It can be from a lot of different muscles, but the most likely one is the infraspinatus. So that's this muscle right here on the back of your shoulder blade. Mm-hmm. Now, the range of motion test for that is, can you reach that muscle? So if you can't reach it, so you should be able to touch the superior spine and scapula on the opposite side.
And
if you can't do that, that's the infraspinatus, but it's in the back of your shoulder, but it's the most common cause of injections in the front of the shoulder. It has nothing to do with actually getting rid of the pain.
And I had a case this week. A patient came in. They were describing the front of the pain, and it really looked like bicipital tendonitis. But I did one treatment there. It didn't help, and so then I went back to the infraspinatus and treated that, and that helped. So
that's the most likely cause.
Yeah.
But of course you can have. What if we treated the trigger points that would be low here? This would be the biceps, and it would cause also front of the shoulder pain, and so that would be real important. Also, you might have tendonitis here of some of the muscles that attach here, right at in the anterior scapula. So, but you could say for front of the shoulder pain, I created this. It's like the Rosetta Stone of myofascial pain. I put it on the website, and I did this with Dr. Simons. I showed it to him, and he and I worked on it together. And he said, doctors and therapists don't know how to find myofascial problems, and really which muscles are the most important one to look for, and how do you determine. And he said, they just don't. They just, it's so complicated. Doctors say, he would say. And he said, this will help them. So the next most likely, so is 44 for front of the shoulder pain, would be anterior deltoid. And then the next one would be the scalene. So anterior deltoid would be, can you get the arm back here? So the same test. And then the scalenes will want to be able to extend the metacarpophalangeal joint and then bend all the interphalangeal joints and not have your fingers sticking out like this. So that then you would know that you'd have compression of actually the brachial plexus, which would be shortening of the scalenes, causing the first and second rib to be pulled up and pressed against the brachial plexus. So what would we do here? So then you'd know, the front of the shoulder pain is probably due to scalene, because that's the one that didn't pass the test. What if you pass this test? They go, well, it's less likely, so let's go on down to the next one. So that's how you use it. Then you go to the next most likely one. Then you go to the next most likely. And the ones that don't pass the range of motion test, that's the one that you needle. And then when you needle, you got to train them to treat it. Otherwise, you're never going to get as good results as you would if you trained them to treat it. Dr. Simon said that.
And that's the self-care regimen that the patient will follow at home.
So what you would do is give them, so what I did was I made a picture program for 44 that's all pictures that I'm going to make available to you. That's so everything that refers to 44 in picture form, so that you can give that to the patient and draw the tool that you want them to use to treat themselves.
And is that included in the handouts that you have that are available as part of the master course?
It is as part of the master course, yeah. We're going to put all of them in, but it could be they're not all there at this point. It could be just the ones that we're working on today, but we'll probably put them all in.
I think that there's 60 available right now for download.
Oh, yeah. 60, yes. Yeah. And I have some combined ones. Yeah, so I already did it. Yeah, so I had planned on doing it, and we did it.
Fantastic.
So I have a program in pictures for every different area, which is so fun. don't you think?
Yeah, it's really, really helpful. And I like things that are systematized, where you're not just guessing. You can follow a protocol that's proven itself useful over decades, and it really makes it easier for the practitioner. It saves them a lot of time learning these things. I learned this stuff in a fairly non-systematized way, where you just had to see the patients over and over, and then you'd start to recognize patterns. And then when I found Travell's work and your work, it's like, oh, this, the other people have gone through this and can save us time on learning these things.
Now, Dr. Simons and Dr. Fisher, do you remember Fisher? Dr. Andrew Fisher?
I'm not sure I'm familiar with.
He's in all the footnotes and everything from Travell and Simon.
Okay.
Because he did a lot of research. And the last time I saw Dr. Simons and Dr. Fisher together, they were arguing about this subject, which was, Fisher was saying he had to put in and highlight the nerve roots for each area. So say, for instance, tonight we're working on the top of the head pain, front head pain, and temporal pain. And for that area, the nerve roots to look for would be C1 through C6. So what I like to do, what Dr. Fisher used to have everyone do, was go ahead and do skin rolling along the spine and pull up, like from C1, can you pull up the skin over C1, C2, C? If you can't, he would have said that you should treat there. And he had everyone treating with acupuncture needles. So he had you treating in various different areas using acupuncture needles and different ways of doing it. Sometimes doing very superficial, leaving it in for a long time. Sometimes going in the different ligaments and different areas to make sure that in different muscles, so that you'd make sure you release the spinal root. And then how would you know you fixed it? You go back along and do the skin rolling again. And if you could pick up the skin, then you knew you had fixed the supersensitive spinal segment.
Thank you for listening. Watch for Eric's book on advanced Asher acupuncture techniques. Don't miss being notified of its release date and when the latest blogs on useful clinical tips and techniques are posted. Stay informed and up to date by signing up now at our website, asher-acupuncture.com. Now back to the program.
Now, I've seen some people talk, I think the term they use is trophodema, where there's some edema under the skin that corresponds with a nerve root that has trouble. Is that related to what you're talking about?
The thing that you use that sometimes in acupuncture, you've seen it, but it goes, Dr. Fisher used to call it the skin conductance meter.
Okay.
But, wherever
it's a point finder.
Tone,
you'll
see, so it goes that thing, right?
Yeah,
right?
Yeah.
So he called it the skin conductance meters, but other people call it other things. But he didn't use it for treatment. He was using it mostly just to look for the supersensitive spinal segment. So the segment that's supersensitive or heightened tone that could be activating all the trigger points in that muscles, in that nerve roots, that nerves distribution, that segment will be heightened tone, will sweat more, and won't let you pick it up. Okay, but there's other things you could look for too.
And so you found, at Dr. Fisher's work, he's found a good correspondence between all those, so you could pick which one you want to use clinically to diagnose that area. Is that true? Okay. Yeah,
you could use different techniques, but I like to use those. You could use one, you could use another, or on my chart, you could just look and go, C1 through C6. So then you could go, let me just treat there. So you could look there, and look for dysfunction. Or you could in every case, remember how I do in the newsletters, I tell you how to tell whether you fixed it. So I think it's really good to know whether you could, the trouble with just treating an area is you don't know whether you fixed it or not.
That's true. Yeah. Right.
Okay.
Right.
So
unless you want to wait and wait for the patient, wait some days or a week for the patient to come back and report.
Right. I agree. But it's sort of, even without them saying anything to you, you could know that you fixed it.
Right.
Because you can see you've increased the range of motion, even if they haven't even if they're not aware yet. You know that you did the right thing because you've increased the range and you got the spinal root to let go. So you feel, it's going to work because it's spinal root to let go. Now we're going to go to the muscle. And most likely, then you won't have that underlying perpetuating factor. And again, we could treat the rotatories, the multifidus, and the longissimus and iliocondylis with the acupuncture needles. But the trouble with doing it with acupuncture needles, in my opinion, in the whole system, and everywhere, everyone doing it is, my opinion, is that if you don't train everybody to really take that muscle through range of motion, both macro and micro, by treating it, get into treating it at the same time while you're moving it and making sure that it has full function. You could be doing, I'd say, an excellent job that you treated a part of the body for them. But if they don't know how to treat it themselves, really, have you really done anything, really? Okay, maybe you did something, but it's really good that you train them to treat it. And then you make sure that you're going to get a good result.
It's great advice. Now, Sharon, you don't do any injection work yourself, do you?
No, I just was trained in it, but I don't do it because I'm not licensed.
And so what's the technique you use when you're deactivating these points? Is it ischemic compression or?
Compression, I'm using, Dr. Simons said what he wrote a paper, it was not too long after they came out with their second book, he wrote a paper that he felt the compression was the best technique, even though all his books were about injection. Okay, everything was about injection, right? Or all of everything. But I said this to Dr. Travell too. I said, Dr. Travell, why didn't you put it on how to do the hands-on in every one of these chapters? And she says, that's for you, right? She says, doctors were trained to do injection, and so we're doing injection. But Dr. Simons, after a while, he began to feel that it was much better that you should show the person how to treat themselves, because then they would really, like if he injected somebody, they didn't learn anything, But if he showed them how to treat, if he treated them hands-on with compression or ischemic compression or with pincer compression or other kinds of compression, he felt that was really good because the person actually learned how they could fix themselves. So he said even the treatment of doing compression, like doing acupressure, but treating the areas that are causing the pain and dysfunction, treating those using hands-on compression, he felt that was really, really maybe the best thing.
And the patient too, they're getting a therapy, but they're also understanding the feeling they should be feeling when they're treating themselves, right? The area and the type of pressure that they should be using. But
also, it's like, I started the fibromyalgia clinic in 2000, where we just had people come in with fibromyalgia. And that clinic, if you just think about people that are really, really, really in hypersensitivity, and they can't even stand acupuncture needles because they hurt too much, so you can't even do anything to treat them, in many cases.
Yeah, you can barely touch them in some cases.
Barely touch them, right, because they're so super sensitive. So I got them all back to work. Everybody, I got them back to doing everything. But it's almost like as soon as they got to the point where not the treatments worked for them, but they could treat themselves and feel that they could have a good result, that they turned from being a victim to a person who knows they can help themselves.
They're empowered. You empower them in a way to take care of their own condition.
Right. Not to be so fearful, not to be so much in fear of these conditions, that most likely they're myofascial and we can correct them ourselves.
Fantastic. Sharon, you've really shared a wealth of information with us. I'm going to put links to the master course, the Body Workers Master Course. I'm going to put links to your website below. Is there any special place that people should try to connect with you? Is it myopain.com? Is that the best website to use?
Yes, that's the best. Really good. There it says myopain.com, myopain.com, www.myopain.com. But also you could go to, you could get on Periscope and you'll see your National Self-Care Alliance, your NSCA.
And I'll make sure I include that. Yeah.
So that's at So that'll be great. And we'll be doing broadcasting every Tuesday at 6:30, a different part of the body, all 60 areas of the body. We're going to treat everything and learn how to get rid of every kind of headache, jaw pain, shoulder, neck, every kind of elbow, hand, finger, low back, knee, foot, everything. So we're going to cover the whole body, how to get rid of every kind of pain.
Fantastic. I'm looking for the first one, looking forward to that first one later today. Thanks again, Sharon, for taking the time to talk with us.
Thanks for having me.
We hope you've enjoyed this episode of the Asher Acupuncture Podcast. We'd like to hear from you. If you have a question, topic idea, guest idea, or a particular technique you'd like to hear discussed on the show, contact us at our website, asher-acupuncture.com. That's ashi-acupuncture.com.